Hi, I'm Sarah. I'm one of the midwives teaching hypnobirthing here in the Rotunda. The other midwife who I'm representing as well is Nadia Arthurs. Both of us went on a hypnobirthing course run by Judith Flood back in 2015, and we've been teaching hypnobirthing here for the last 5 years. I work in the private clinic in outpatients there, and I work up in labour ward as well. So 2 shifts in the private clinic and 1 shift up in labour ward every week. Okay, so what is hypnobirthing? Hypnobirthing is an extra tool. It's a tool which women and their partners can use in order to keep themselves relaxed, both during pregnancy, postnatally, and then afterwards as parents. In hypnobirthing, we encourage women and their partners to listen to a script or several scripts, whichever they want to do. We do massage and positions with them, we do mindfulness with them, and we're just giving them extra tools so that they can be calm in pregnancy. Okay? And when they're listening to their script in pregnancy, their baby is also hearing and noticing how calm their mum is. Then in labour and birth, they're using the tool of hypnobirthing to keep calm, so that they can make good decisions that they're happy with and they have a good birth experience. And that's what our aim is, a good birth experience that the woman and her partner are happy with afterwards. And then postnatally, we have anecdotal stories to say that hypno babies, so where the mother has practiced hypnobirthing, that her babies tend to be calmer. And if the baby does get upset, that if she plays the script, it calms them down, because they associate that with a calm mum, and it just helps them calm down even postnatally. So it's a tool that's useful right throughout pregnancy, birth, and then postnatally. No, not at all. I actually encourage my couples to start at around 24 weeks, and then they've got loads of time for listening to scripts and preparing for birth. But I have had women listen to or join my class at my latest one was 37 weeks, that she finished the course at 37 weeks, and she used her hypnobirthing amazingly for her birth. So yeah, 24 weeks is ideal, but it can be done right up to 37 weeks. Okay, so in the antenatal classes, the teacher will refer to hypnobirthing and talk about, just very broadly, about the benefits of hypnobirthing. The app, there's a great Australian app called Mind the Bump, which is great. I'd recommend people listening to that. And yeah, with our hypnobirthing classes, we have a script which we give women and to listen to, which is great. The difference would be that with the hypnobirthing that we teach here in the Rotunda, it's always given by a registered midwife. So the only people that can do our hypnobirthing course are registered midwives, and that's who deliver it. There's several, and the aim of all of our techniques is to help the woman to calm down or to remain calm. And our partner, it's really important that our partner is able to remain calm as well. And if either of them start to lose that calmness, that we then try to get them thinking about something what we call an anchor, where they can think of something or look at something which is going to help them calm down really, really quickly. And that's the aim, is just to help the woman, first of all, to find ways that help her calm down, and practice those ways. And the more she practices them, then the quicker that they will kick in afterwards. After all, the brain is a muscle, and it's muscle memory, so if we've worked that muscle well, that it'll work great for her when she needs it. Okay, yeah, so unfortunately this is anxiety producing environment that we're in at the moment, and it is tough on our mums and our partners. And hypnobirthing is something that it can really help here, because it will calm the woman's anxiety down and get her producing the hormones that she needs for birth, not the anxiety, the adrenaline. And what we have as well, one of the tools, is that it's a fear releasing technique where we encourage the person to bring to mind the fear that she has. And so if it's COVID related, that she brings that to mind, and then we give her tools to get rid of it, to get rid of that quickly, so that yes, that she'll have that memory, or she'll have that idea that she won't, maybe her partner won't be with her all the way throughout her birthing journey, but that the anxiety that went with that thought won't be there if she's practiced this fear release technique. Yes, I work one day a week up in labour ward, and so I tend to see, well, you know, hypnobirthing is, all midwives tend to see a lot more women using hypnobirthing. But it is just amazing to see the women using hypnobirthing and how it keeps them calm. They're able to make decisions that they're happy with then. You know, it's quite phenomenal how just focusing on the breath and staying calm can help the woman deal with whatever is on her birthing journey. So yes, it does work. No, not at all. Hypnobirthing, our aim is for the woman to have a positive birth experience. We cannot guarantee any woman that she's going to have an experience without any intervention, or that she may not want to have an epidural. We can't guarantee that to a woman. In hypnobirthing, there is a lower uptake of epidurals, there is a lower rate of interventions like emergency sections or instrumental births. There are a lower rate of that, but we can never say to a woman, if you do this, you definitely won't have those, because that's not what it's about. It's about the woman having a positive birth experience, and if those things are on her journey, what hypnobirthing helps is for her to be able to accept those and see them as a positive stages along her journey. Apparently 1% of women don't experience pain on their birthing journey, that they experience pressure just. And some hypnobirthing women that have attended my class would report that. So yes, hypnobirthing can assist a woman to have just for her to feel pressure in labour and birth. But some women will experience some pain, and some women experience pain at a rate where they want to have an epidural, and you know, that's fine, that's their birthing journey. Yes, in hypnobirthing, birth partners have a very, very big role, and we really want them to come to classes so they can, first of all, learn what hypnobirthing is about, because a lot of partners would kind of have this thought that it's airy-fairy, and you know, hypnobirthing, they kind of think, oh, that's just, you know, that's hippie stuff. But when they come and they learn why hypnobirthing works, you know, how birth works, and then how we apply hypnobirthing to it, that we get them on board, and they're great support for the women as they're birthing. And they need to, you know, fear is contagious, so we need the partners to recognise any fears that they have and to be able to deal with those fears, not to push them under the carpet, but to deal with them. And if they start arising for their partner during the birthing process, that they're able to deal with them the same way as a woman's able to deal with her fears. So yeah, we want the partners in the class because they're so important for the women, but they have a huge role and they need to learn that.